Your doctor says you need a medication, but when you go to pick it up, you get turned away. Patients and doctors took their frustrations to Fox 6 investigator Amanda St. Hilaire. She's live in studio. Amanda?
Ben, the medication designed to help people fight addiction is also potentially addictive. So as doctors, pharmacists, the state, and the feds try to balance treatment with oversight, patients say they're the ones who are dealing with unintended consequences. It's supposed to be a quick errand, but all this is enough to send Tina
you freak out
into a tailspin.
I mean, as a drug addict, my brain is like, and you add anxiety and stress and worrisome when you go pick up your prescription.
Tina Caston says she's put every second of the last 8 years into recovering from a heroin addiction.
I tried doing it by myself because, you know, every addict thinks they can do it by themselves.
Tina eventually found a doctor who connected her with therapy, meetings, and a prescription for buprenorphine, often known by the brand name Suboxone.
I didn't have the cravings all the time. It wasn't constantly on my mind, like, okay, am I going to use? Am I not? Am I going to use? Don't do it. Oh, but you should. It's like the devil and the angel. And Suboxone kind of just tells them to be quiet and go home.
But getting the prescription is a lot easier than getting the medication.
I think we have to look at it as a health concern.
Here's where it gets tricky. Suboxone treats addiction to opioids by partially working like an opioid.
That's what allows it to be so useful in addiction treatment, because it doesn't give you the euphoria associated with opiates, but it protects you from cravings and withdrawal.
It can be used to help somebody get rid of the addiction to opioid. It itself can be addictive. So the pharmacist has to balance between the risks and the benefits of the Suboxone, and that can be a challenge.
A challenge putting patients like Tina in the middle.
You have one day that you'll be okay because it's still in your system, but after that, I mean, you have sweats, headaches, you sneeze all the time, you're throwing up.
The Fox 6 investigators talked to 13 other people who did not want to be identified, but did say they have also had trouble getting Suboxone prescriptions filled in Wisconsin over the last year. Pharmacists, doctors, and counselors say they're hearing the same thing.
It's definitely not a, oh, shucky darn, you know, let's wait till next week or tomorrow. It's usually, I need this medication today.
Oh, it totally takes them off their tracks of recovery because they're so focused on the withdrawal and their physical pains of withdrawal and their emotional pains of withdrawal. Oftentimes, patients will likely relapse with the drug that they were offending in the first place.
Unfortunately, it's not as easy as black and white.
The shades of gray start here.
We are currently in the throes of a opioid crisis.
Ignited the state's opioid crisis.
The opioid crisis has gripped every state,
leading to an increase in addiction treatment medication. Wisconsin has seen a 66% jump in Suboxone dispensations since 2016. But while access to Suboxone gets easier, actually taking it home gets harder. To curb opioid abuse, pharmacists will turn patients away if there are too many red flags. Cash payments, signs of doctor shopping, driving long distances to fill prescriptions. But one person's red flag can be another person's reality.
So many patients actually need to travel distances because there's no provider in their rural communities.
Wisconsin has more than 1,000 in-state pharmacies with active licenses. It sounds like a lot, but depending on where you live, the closest pharmacy may not be close. And once you are there, no guarantee the Suboxone will be there.
If they have it, great. If they don't, you're SOL.
It's not easy to get your prescription switched to a different pharmacy, and you don't get extra Suboxone just in case. That's by design, to prevent abuse. But when someone like Tina has to wait 5 days for her medication,
I was like, I can't drive right now.
It's more than an inconvenience.
There's that little voice, since you don't have your safety net, that little voice like, well, if you just do this, you'll feel better. You'll get your, you'll get your homework done. You'll get your kids taken care of, And that sometimes that voice is a scream.
I think it's important for pharmacies to identify what their rules are and what their protocols are.
The Fox 6 investigators asked 8 pharmacies about their policies. Most wouldn't talk. 2 provided some information, and 1
We tell our pharmacists to use their professional judgment.
went on camera.
The fact that we are local make it easier for us to create our own policies within the general pharmacy law.
Doctors say they want more consistency from pharmacies, but pharmacists say the law leaves a lot to their professional judgment, case by case. The feds say that's on purpose because a local chain like Hyatt naturally operates differently than national chains.
There's still productive members of society that are taking it, and they have years clean and they're doing great. Don't count them out because someone else is abusing it.
Tina says she wants protections against Suboxone abuse, but hopes the system will change so that getting her medication can go back to being nothing more than a quick errand.
Walgreens and CVS did not answer all of our questions, but they did send us some information about their efforts to prevent opioid abuse. We also have information from the State Department of Safety and Professional Services and the National Association of Chain Drug Stores on our website, fox6now.com.
Amanda, in this piece you talk a lot about Suboxone, obviously, but is it still tough to get other types of medications to help with opioid addiction?
Yeah, that depends. So Vivitrol, for example, is an easier prescription to fill. It's the only opioid treatment that is not a controlled substance. But Vivitrol is more expensive, sometimes by hundreds of dollars per month, depending on your insurance. It's also harder to start because first your body needs to be clear of opioids and other prescriptions for 1 to 2 weeks. So different hurdles here for different medications.
Yeah, and we should say to Tina, wow, that's really courageous of her to talk to us about this, but it just shows you the struggle, even all these years later, she's been clean, never really goes away. So.
Yeah, it's going to be a lifelong struggle for her, and she told us that the Suboxone hasn't done the hard work for her. She's done the work, but she feels the Suboxone helps.
Yeah, and a lot of people are going through that. Man, great. Appreciate it. Thanks.
Thank you.
Still to come here on